module itself is broken down into 10 weeks of placement. So you'll have a month of medicine placement, and that'll be in one hospital for the entire month. You could be anywhere for it. It's probably what I found to be the most enjoyable month of the 5 years, because most of the consultants start to treat you with a bit of respect, and it all kind of starts to come together. Then you have a month of GP placement, which you could be going back to a GP you had in third year, or you could be going to a completely different GP that nobody had in third year. And again, it's for a month. It can be both in Cork in a way, and it's a bit light, shall we say. So it's a good time to get to not really see that many patients, but to kind of just do a bit of the learning and just a bit of the reading. If you have your final year project, if you have it before your final year project is due, it's a good idea to do a bit of the final year project at that time. Then the last 2 weeks of the module, as well as you have 2 weeks of geriatrics placement. And again, these are they're light enough weeks. And it's just another box you got to get ticked. In terms of during those placements, there's a bit of continuous assessment, which is worth 100 out of the 400 marks of the module. And it's kind of strange in how it all works out. There's a long case at the end of each of them. And so you'll talk to a patient for about half an hour, do an exam, and then you'll present it back to a consultant who will then ask you a few questions either around the actual case itself, or he might ask further questions as well if he wants to. You also get a feedback form from every consultant you're under during this time. So some people might be under the same consultant for the entire month of their medicine placement. Others might switch every week depending on how the hospital runs their show. But each of them a feedback form of where they think you are in the class in terms of your marks, and all of these get added together to give you the mark out of 100. So for example, now it does mean if you get a 1H in just one of them and you get passes in the rest of them, you only actually get the pass out of the 100. You don't get you don't just get one. You don't get 70 marks for one thing and 50 for the other. You get a kind of an average of what you actually are. So that's the actual kind of throughout the year.
The other 300 marks go for the end of year. This is broken into written exams, 75 marks for the MCQs and 50 marks for the data interpretation, and 25 marks for the radiology and 150 marks for the short cases.
So the first thing you have is you have a 3-hour MCQ, which is worth 75 marks. It's kind of same kind of standard as what you have in fourth year, a lot of clinical questions and kind of what would you do first, or what's the best option as opposed to what's the only right option. Then there's a data interpretation paper, which is much easier than the one in fourth year, you'll be glad to hear. And then those are the written exams. Then there are 2 clinical exams. There's 25 marks for radiology. And then the final thing, and kind of the bulk of the marks, is the short cases. So those are worth 150 out of the 400. And what it involves is you go into an outpatient department or into a ward with 2 consultants will come around with you, your 2 examiners, and usually you get through maybe 4, possibly 5 cases, and it's kind of it's a whistle-top tour of clinical signs. Basically, it's not, they don't want to see if you can run an examination from start to finish. They want to realise if you can recognise murmurs, if you can see hand signs. So you might not actually have to be. You might not have to do the full RESP exam. It might be just listen to this person's lungs. It's pretty daunting, I'm not going to lie. It's kind of hard when you come out of it as well to feel good about it.
The things I'd used were the Toronto notes. I'd used them from 4th year into 5th year. Again, I found they're quite useful to give a good idea of the topics you need to know for medicine. It uses a lot of the Canadian guidelines as opposed to the Irish ones, so make sure you use the Irish ones in your exams. I've also found the Alistair Scott notes to be very useful. They're a quite concise, condensed version of the Oxford Clinical Handbook. I also use Pat's Medicine as just a way to go over questions and if I wasn't feeling up to actively studying. Other things that are helpful for the exams, you'll be given a lot of supplementary lectures at weekends over the course of final year. Michael Connor is a geriatrician who gives a lot of short case preparation. These are good to go over topics that commonly come up in short cases, and more than anything just to get the confidence in the structure to present with during the short cases. Bernard Creedon gives a lecture on examination technique. This is quite useful. Professor Caplice gives a lecture on ECGs, which is pretty handy. They may come up in data interpretation or the written papers. And Fikra Maloney gives a very good lecture on the radiology. It's all you need to know for the radiology exam, and I'd advise going to any of these that you will be able to make it to. I found them all very useful.
But what I'd recommend really for the entire year is just to do as much practice as you can on your placements. Really at this stage, kind of most of us are able to take a history, no problem. So the best thing to kind of do on the months that you're in the hospital is to just check with interns and see what patients have good signs, and just go have listen to them. Don't bother with the history. You can see three you can see 3 patients with signs in the same amount of time as you could take a history, and a history is worth very little marks to you in final year.
Pediatrics, when you start final year, I think it's fair to say is the most daunting module. So it's said that the standard is very high, and it is, but it is also very doable.
So your PEDS module has a bad reputation, but it's not that bad. So we'll have 4 weeks of PEDS placement, 2 weeks in COH, and then 2 weeks in another hospital. It could be a Cork hospital, or it could be outside of Cork, and that could be either way around.
Placement tends to be a lot more hands-on than 4th year. I actually really enjoyed it. The doctors are much more happy to see you around the wards, listen to histories, and you get a lot more exposure to the children. And I would recommend going in, taking a few histories, just so you're comfortable with children by the time the OSCE comes around, because they will be using real children in your OSCE, just in case you're frightened by that.
Your continuous assessment is a feedback form at the end of each year, 2 weeks, so that's 2 forms worth 10 marks in total. And you also have to present a history to a consultant, so that's another 10 marks.
You'll have to present a history to your consultant who will grade it. It's a very easy way to get marks, because you can take the history the day before, go home, write it up, look up around the topic, and the consultant will probably know you from the 2 weeks, so it's usually pretty okay.
Then in terms of the exam, you have an OSCE either at the end of the first semester or at the end of the second semester, depending on when you did your placement, and that's worth 60 marks. That's a tricky enough OSCE, I guess. There'll always be one station that goes badly for you, but there's nothing too major to worry about. If you know your basics, you'll be alright. They'll have guidelines and algorithms to follow up on Blackboard for that module, and if you just know them, you'll be fine for your OSCE.
The topics were quite general, quite broad. They tend to do quite broad topics like, okay, a child presents vomiting, and then you just have to work through it rather than a specific diagnosis. It's usually pretty doable, and really the 4 weeks you spend on the wards during placement really do help. If you have put in a good shift, it does transfer to good marks in your OSCE.
Then in the exam you've got an essay paper, so you'll have 6 essay questions. There'll be internal choice in each one. You have to write 6 essays. They're alright. The past papers aren't necessarily going to help you, but if you have a general idea of the basic topics, you should be fine with that. And then there's an EMQ paper worth 30 marks, and certainly we thought that was going to be bad, but it wasn't as bad as it was in the end. So pediatrics has a bad reputation, but they're actually quite nice in the end.
So in terms of things to study from, so firstly, a doctor called Dr. Cathal O'Connor has for 2 years now done review lectures for pediatrics. His notes will be available. I'm sure someone will send them on to your year, and they're brilliant. So he covers nearly every topic you'll need to know, and they're just the best resource to use. Other than that, then you might need to use I would just get one other resource to read around the bigger topics, because Cathal O'Connor's notes are a bit shorthand. So personally, I use the pediatrics notes in Toronto Notes. I thought they were very good, but people also use the illustrated book of pediatrics. It used to be called the Sunflower book. I've just been informed there's no sunflower on it anymore. But either way, just a quick read around the topic. The thing about pediatrics is it's not about specifics, and the earlier you realise that, the better. So the essays won't be very specific. They tend to be broad topics, like we got one that was a child with a limp, and so instead of just focusing on one thing that causes a limp, you have to work up a whole range of diagnosis. So if you just focus on broad things, I think that's the way to go.
Kind of have a breakdown of 3 different bundles of marks. You get 40 marks for continuous assessment, which are lots of little bits, but they're easy to get and they all add up. If you just turn up a placement, you'll get them.
The marks are broken down into 40 for end of module MCQ and feedback from your supervisors on placement.
And there's 80 marks for the written paper, which is quite simple. There's a lot of repetition over the years. So in your last month or so, if you just keep looking over the past papers that have gone before, you'll be fine for the written paper. And then 80 marks for the long case, which is a half hour of a history with a patient, and then 10 minutes of questions about the patient, and then 10 minutes of questions about the other topic. So if it's an OPS patient, like an IE question period, and vice versa. Now we had that in the last period of exams when the writtens were on, but there's talk about it being moved to when the placement is on. I don't know what the story will be, but either way it'll be fine.
I think the most helpful thing for that really was when you're on placement, try and take as many history exams as possible, get comfortable examining the gravid uterus. I would just say practice as much as you can on placement for that, because really you can't particularly study for the cases that come up. For the written exams, I think the guidelines are the most useful thing, and the past papers are extremely useful in the weeks prior to the exam, because there's a lot of repetition throughout the years.
In terms of what you can use, there's a lot of books out there, you can use what you like. I think the past paper is the best thing to use because the amount of repetition that keeps coming up. And if you just turn up to placement, you'll actually know what they're talking about when they ask you questions. In the long case, I was going to be fine, fear about that.
The most useful resources really are the Irish guidelines, the UK guidelines, and I also found 10 teachers useful enough for the basic concepts. MB and title is also very similar, so either one of those is very helpful. And the marks for the year are broken down into 80 marks for the short cases at the end of the year, 70 marks for the written paper, which is made up of 25 marks for the MCQs and 45 marks for the short answer questions, and then 40 marks for the long case, which happens at the end of your rotation, and then 10 marks for supervisor feedback, be it 5 and 5 if you're in 2 separate places for 2 weeks each, or just 10 marks if you're in one place for the 4 weeks.
In terms of what the placement entails, it's 4 weeks. If you're in a Cork hospital, you'll do 2 weeks in the CUH, and you'll do 2 weeks in either the Bonds or the South Infirmary. And if you're in a peripheral hospital such as Clonmel, Tralee or Waterford, you'll do the full 4 weeks there. For the placement itself, you'll hear all these horror stories of long hours and consultants throwing stuff and screaming at you, but it really isn't like that at all. It's very good kind of teaching wise, and I find it was one of the more structured modules throughout the year. It is a good idea to try and minimise the amount of time you're in theatre though, because it's essentially a waste of your time. Now obviously there's a bit of kind of having to show face for the consultants, because it does require feedback throughout the year. But your best bet for the placement is just to spend as much time on the ward, seeing patients. Again, kind of taking histories at this point is kind of something that we should all kind of be pretty good at, but in terms of just seeing patients with good signs or with different drains or who've had different operations and things like that. And I know it can be difficult in the peripheral hospitals where a lot of the surgeries won't be done there. But overall, it's not the worst placement ever. For your continuous assessment throughout the module, you get 40 marks for a long case. So what this involves is you'll have 2 consultants will come or will send you to a patient. You'll have half an hour to maybe 40 minutes, depending on how they're structuring it themselves, with the patient by yourself. And you can take a history, do an examination, check their drug chart. You can't go near their actual chart, but you're by yourself and you use the time to your best advantage to get as much information from the patient. Then the 2 examiners will come into the room and you will present back your history and your exam to them in front of the patient. So don't lie about what you have or haven't done. The patient will know. And then they might ask you to demonstrate part of an exam, or if you found a finding, they might ask you to show how you found the finding, and then they might ask you a few questions around the history. It sounds daunting enough, but it's actually pretty straightforward. Again, you're actually with the patient by yourself for the majority of the exam, so it's very short with the examiners, and it goes by very quickly. And these examiners have been doing it for years, and they're all very nice and only asked to do them because they are so nice. And then what the short cases themselves actually entail is you go into a room. Again, you'll have 2 examiners. In surgery, it's 20 minutes long. You go to 4 stations, 3 actual patients and 1 with pictures, and then they'll just ask you to maybe examine this man's foot, have a look at his hernia, what type of drain is this, what kind of surgery has he had, what are the indications. It's very rapid fire, very quick. Sounds very stressful, but it'll be the fastest 20 minutes of your life. And again, they're all lovely, and just a bit of practice throughout the year really sees you through.
For the short cases especially, was a book called Ramachandran, Clinical Oscopies and Surgery or something like that. And I think this is definitely, in the days leading up to the short cases, was definitely the most useful resource. In
terms of the final medicine exams, there's a written paper, which is 45 marks for short answer questions. Very doable. I really recommend having a look at the past papers. They tend to repeat. They're very factual. They're not looking for the weird and wonderful. They just want to make sure that you're safe and competent, and even just to look over 1 year's previous paper might cover you for at least 60 or 70% of your own final paper. There's then a series of MCQs that are worth, I think, 25 marks. And these are tough enough, but your study throughout the year should be able to see you through.
For the written papers, I would definitely recommend Alistair Scott's notes. I know some of the surgeons at CVH also recommend the surgery part of the Oxford Handbook of Medicine, which is also definitely useful for getting core concepts. And for the long case, it's just like I suppose any other long case, try and get as much practice as you can on the wards. Spend as much time with the surgeons as you can on the wards as opposed to maybe in theatre, and just see as many surgical cases as you can to prepare yourself for the long case.
So you hopefully have a project by the time you start final year. And if you don't panic, there were a few who didn't have one by this stage. And really most of the work is done right at the start of final year. So I would advise getting the bulk of the work done early before you start really into the final year study. Just get the final year project out of the way just so you're not worrying about it later on. So the marks for the module are broken down into 65% for your write-up, 25% for your project presentation, and then there's a 10% kind of assignment.
10% of the module is going for an essay which you'll write at the end of the tutorial block. It's interesting. You're sent an email and given 20 minutes to write an essay on professionalism. This can be quite varied topics such as writing a sick cert, or dealing with medical error, or dealing with overprescribing, or treating PEs, or giving IV medications. And then you have to email this back to the med school within 20 minutes. The other 90% of the module consists of your FYP. This is broken into 35% for your presentation, which generally happens sometime in November. It can be daunting.
Now, the project presentations, they're a cause of a lot of stress for people, but they're actually very okay. So that just involves you making a PowerPoint for your your project, and then standing up and presenting it in front of 3 judges. It's nerve-wracking, but it's very doable, and the judges are all very nice. So just make sure you have a very clear message with your project, a beginning, just kind of why you did what you did, a middle, how you did it, and a conclusion, what did you find? And just have a clear message so they can follow you throughout, and you'll do fine.
The best advice I give is just practice as much as you can. Practice in front of your friends, practice in front of your supervisor, send him on or your presentations, get feedback as much as you can, and just be as confident as you can. It's 7 minutes of something you will have completely prepared and practiced dozens of times over, and a few minutes of questions afterwards.
Write up, so that's usually after Christmas, so most people spend a week in Christmas, just put it aside to write it up. You could look at it earlier if you had a tutorial block or a GP placement beforehand if you wanted. But the big advice I would say for that is they have some prior write-ups on Blackboard which you could look at and kind of follow those. Or if you found a project that's quite similar to your project that's been published, it's very handy, you can just kind of follow the guideline they used.
Just in general, maybe stay inspired and be positive always, and even though things might be hard, but I'm sure that everyone, there's lots of people who have done it before and everyone's succeeded. I'm sure you can too.